Dr. Warner, welcome again. Thank you for doing this. We are doing a cardiac series. Today we are talking about aortic dissection. That sounds complicated. What is it?
So aortic dissection is very important to recognize because it can have a very high mortality rate. What it is, the aorta is the main blood vessel that carries blood away from your heart and brings it to the rest of your body. So in an aortic dissection, the inner wall of the aorta gets damaged, usually through a tear, and then blood starts to course through the tear, which then causes the damaged area in the tear to propagate even further and extending the tear through the wall of the aorta. So as a result, you have blood flowing where it shouldn't be in the walls of the aorta, and this weakens the integrity of the aorta, and then it increases the risk for rupture. In addition to that, you now also have less blood flowing in the actual vessel itself going to the vital organs, so the organs then can suffer and get injured as well too. So like I said, really important to recognize it. It's an emergent situation because at least 20% of people die before even reaching the hospital. And in the absence of recognition and treatment, the mortality rate increases every hour and can reach up to 50% within the first 24 hours.
Well, how would I recognize it? And what is, statistically speaking, how many people have this?
So statistically speaking, it's really hard to get true measures of estimates of the frequency of it because the results are so devastating and catastrophic and early mortality is so high. So getting true numbers are quite difficult. But incidentally in autopsies, it accounts for, or aortic dissection is seen for as many as 3% of all autopsies. And so in the U.S., there's estimated to be about 1 per every 10,000 patients that actually get to the hospital. And it's estimated more than about 2,000 deaths per year.
Wow. What are the symptoms?
Symptoms can be quite variable, but the most common significant symptom that people feel are this sudden onset of just severe, sharp, often described as a tearing sensation in the chest or the back or your abdomen. Those are all of the locations where the aortic vessel courses through. So a sharp, tearing, intense, significant pain is the most common symptom. If your heart is getting compromised with lack of blood flow, then you can have additional signs and symptoms of heart attack. If your brain isn't getting enough blood, you can have signs and symptoms of stroke. If your legs are getting enough blood, then you have severe pain in your legs as well too. So wherever that aorta is serving blood to can often have the sharp tearing pain and then the associated symptoms of the organ that's being compromised.
Okay, so how do you diagnose this?
So first and foremost, it is just getting to the hospital, calling 911 and getting to the hospital as fast as you can. And then once in the hospital, based on your clinical presentation and then additional tests, most often involving imaging in an emergent situation, then leads to the appropriate recognition and then treatment. And treatment, again, then depends on the exact location of the damage to the aorta and the organs involved, but usually will involve aggressive management of lowering of blood pressure to try to stop the tearing of the vessel, and then usually some sort of emergent surgical correction.
Wow, this has been fantastic information regarding cardiac symptoms. Dr. Warner, thank you for your time. Excellent, excellent information.
Thanks for having me.